So what our country needs most to tackle this youth mental health crisis is truly a continuum of care. If I have a toothache, I don't go to get a root canal. At the next time that I go for a cleaning, I mention that I have a little bit of an ache, and they might find a small cavity and they might decide just to watch it, or maybe they will go in and help address the cavity. And so what ends up happening in that situation is that we intervene at the lowest level of care possible. We don't want to go overboard with interventions from a healthcare perspective. It's the same exact thing for mental health, is we want to intervene at the right level at the right time. There's this whole component of programming, intensive outpatient programming, in-home, wraparound community services, day treatment programs that allow us to ensure that the teenager, the kid can stay at home in his school as long as possible to address the issue versus jumping to a hospitalization. The second part's going to be about partnering with insurance companies. This continuum of care and services is what insurance companies want as well. An insurance company wants to contract with an organization that is focused on addressing the exact issue at that time with the lowest level of care and the least invasive. So what we want to move towards is a model where insurance companies have trust in a relationship with providers where they are able to say, we have a complicated situation and we're not exactly sure what they need. We trust you to help figure that out. The types of therapy and treatment that are most important for teens are those that are more program-based and family-based. And that's different than adults. The big reason for that is simply the brain. The brain isn't fully developed until the age of 25. It's about engaging the young teen brain. It's about engaging their body and their nervous system in this treatment, in the therapies. And that requires a different way at looking at our mental health care providers and our mental health care service offerings. We need more than just the individual therapy, the psychiatry, and management. We need robust outpatient programming that really go deeper in terms of addressing the issues at the nervous system level, at the subconscious brain level. We need to create these intensive outpatient programs that have a lot more activities and are a lot more creative, and there's more clinicians involved in the room to facilitate this healing. We still want to use evidence-based treatments, but we don't need to do that sitting down per se. The other aspect that is really important when it comes to teen treatment and therapy is family systems therapy. We really need to understand how that family dynamic interacts. And that's critical, particularly in the early life, is to really create a strong family system where the parents are consistent and predictable caregivers. As a parent, sometimes often we can be as, my child is okay, I'm okay. My child is hurt, or I'm not doing good. The problem is that ends up becoming a burden for the child. Subconsciously, they start to carry that burden knowing that they are dependent on you and you them. That creates codependency. So it's really important when we're working with teens to work with that family system. We really believe that you don't change or fix a kid. If you want to change a kid, you need to change their environment. In terms of the future of treatment and therapies, I really think that we're moving to a place that empowers people to understand more about their mental health. That can really involve wearables. And what's going to end up happening over time is we're going to start to have treatment plans created by professionals that involve wearables and empower the individual to understand, where you combine physical and mental health and start to understand more about how what we eat, how we sleep, and what we do during the day, as simple as sun exposure, impacts our mood. There's a lot of research that shows that that really grounds us more, helps our mood, helps our stress, helps our anxiety. And so the future really is about connecting those better. So our belief is that treatment plans with different providers are going to start to include a lot more around diet and exercise and sleep in order to address our mental health issues. It really empowers the client with information and tools, along with all of the right family interventions, the therapeutic interventions that revolve around empathy and compassion and acceptance. That combination is powerful and is a likely innovation to come over the next few years in our mental health field.